Welcome to Conceive the Podcast, your resource for all things fertility, women's health and pregnancy, with your hosts, Jaya, Chinese medicine practitioner and Director of Natural Fertility Geelong, and me, Libby Morgan, Practice Manager and Jaya's friend. We've had so many fantastic guests on the podcast, and today is no exception. Dr Edwina Coghlan joins us from the OGB Surf Coast Group to discuss a topic that we think you're going to find really interesting, egg freezing and what's involved. Edwina practices obstetrics, gynecology and fertility and believes in a holistic, patient-centred approach to women's health and pregnancy. Her gynecology expertise includes menstrual disorders, vulvar disorders and pelvic pain. She lives on the Surf Coast with her young family, and we are so grateful for your time today. Thank you. Welcome, Edwina.
Hi, Edwina.
Hi, thanks for having me.
Can you tell us a little bit about yourself and how did you get into gynecology and fertility?
I am a mother of 3 young children and also wife to my husband, Brett. And I moved to the Surf Coast 6 years ago.
Yeah.
So I came over from Western Australia. So I'm a born and bred Sandgroper and Fremantle supporter. And I came over here to do, I guess it's always really good to see things done differently and different ways to practice women's health.
Yeah.
So I came over here for 12 months and to work in Geelong, but love surfing and from a very sporty background. So I thought obviously live down on the Surf Coast and drive into Geelong rather than the other way. And I just loved the lifestyle down here.
Yeah.
Loved the community and the people. My children were incredibly settled, and with my husband's work, we just found ourselves here.
Nice.
And it's become home, and it's just, I feel like we're with our people here and just love the community and the opportunity, and our children are really settled. And so it wasn't a life plan to end up here, but it certainly is where life is now, which is fantastic. And I was also really inspired being here just with some great women that I work with OGB Surf Coast. And I just love the fact that I love the proximity to Melbourne, but also that we can deliver just excellent kind of healthcare in this community. So, it's a combination of factors. But I always thought I wanted to do women's health. Even when I first started medicine, I hadn't even seen babies being born or done ONG, but I knew it was a specialty and I thought, wow, that's pretty incredible. And then once I started, I was fortunate to do my ONG in a regional community very similar to Geelong in Western Australia. And I had a woman called Anne who was, I guess, our teacher through uni, and she was just really fostered my passion for women's health, and she was amazing. She was a mother of 2 and had a busy partner, and I just remember watching her kind of balancing everything and just thought she's so inspirational. And just I think the whole journey of being with women right through their life and then obstetrics is amazing.
Yeah.
Like pregnancy, I'm still blown away every time I see a baby born, just what our
never
bodies
not
can
special,
do.
is it?
Oh, it's just incredible.
Yeah.
And just what a privilege to be able to do that every day. Like I wouldn't have my life any other way. It's fantastic.
Oh, I love that. I love your
The
passion.
hard work's worth it.
Oh, it's so good. It's just, you can almost pinch yourself that it's an area of medicine.
Yeah.
And you're in such a nice team.
Oh, yeah, they're fantastic.
So supportive of each other.
Yeah, just really inspirational women, and we're all very like-minded, which is there's moments in life and you can never plan it. You'd always think I'd love to work together, but it's very rare that you all cross paths, come across each other and at the same time in your lives are ready to start working together and building something. And so it's just, it's fantastic. And we spend so much time at work, so you want to be surrounded by great people.
Absolutely.
Yeah.
All right, so today we're talking about egg freezing. So maybe you could start with telling us what that really involves.
I might tell you just, I guess, quickly before that about, I guess, the history for it. It's a reasonably new thing.
Yeah.
So I still remember the tutorial I had when I was in second year of my training. And I remember I think fertility is a whole subspecialty of women's health. And I still remember the day that there was this kind of article published in the New England Journal of Medicine, one of our big scientific journals, and it was all about egg freezing, the technologies there.
And how long ago was this roughly?
Oh, it would have been 12 years ago.
Yeah.
Wow,
and
that's
it was
not long.
Yeah, and it was a big paper that came out that pretty much said we should be talking about this and offering it to women. It's a thing, it's possible, and we need to start talking about it. And that was from a general, like a primary care general practitioner level.
Yeah, and I think we were talking about this on the phone the other day, that it's not necessarily happening those conversations enough yet.
No, still, I guess people don't know that it's an option
Or at the right time?
and when to have it and what it means and the success behind it. So essentially what it is putting I say a woman, or I guess someone that's got ovaries, because certainly people that are non-binary or trans can also go through it, and actually it should be discussed with them before they did that transition.
Yes. Yeah, that's a really good point.
Yeah, but essentially it is put your ovaries through an IVF cycle. So you want to do super ovulation, so recruit all the follicles in the ovary and then go and pick up all those eggs, and then essentially that they would be ready to be fertilized, and then you're going to freeze them and store them. So it's the same process as going through, very similar to going through IVF, and you, of course, want to, put a patient through that cycle. So it's quite similar, but you're obviously not then going to make that next step to make embryos, which you would with IVF.
And is there an ideal number that you like to freeze?
So I guess we're still starting to emerge with some of that evidence and those numbers, but most people would say around 20. It's also important to know that it's not a given still, because you still don't know what's going to happen when you fertilise those embryos long term. But what we do now is originally the science, it wasn't as good as it is now, because you could pick up the eggs and freeze them, but when we thawed them down, we'd often lose a lot of their eggs, so they wouldn't survive the thaw down process. But the emergence of cryopreservation means that there's now like a 97% kind of, I guess, survival rate when you thaw down the eggs.
So you're able to freeze them, thaw them later, fertilise them.
Yep.
And then freeze them again?
That's a great question that I actually don't know the answer to, and it's something that we don't offer. So what you would do is either freeze the eggs.
So you'd thaw 1 or 2
fertilise. So what we often do is we'll thaw down. So if you froze your eggs and then found a partner and wanted to now make an embryo and try and get pregnant, then you wouldn't freeze them. You wouldn't thaw them all. You'd thaw a few, try and make embryos, and then and then freeze those embryos, and then either do a fresh transfer and things like that.
Yeah. Okay.
What are some of the side effects of that process, of going through that process?
I guess I think first of all, it's really important to, I think, acknowledge, the emotional side of, making that decision and walking through that decision.
Huge, isn't it?
Absolutely. It's really great that people are talking about fertility and that it's a thing and that it has an emotional impact on couples and individuals. But I think the idea of having to think about, I'm going to freeze my eggs, what does that mean? I think that in itself is quite emotional. So I think you need to be prepared for that journey. And then the other thing is, the physical side effects of going through picking up, having quite high doses of hormones to recruit as many eggs as possible from your ovaries. So everyone responds to an IVF cycle differently. Most people have side effects. Is it quite similar to what you would experience with menstruation or having a cycle? So it may be headaches, nausea, bloating's very common, feeling very emotional, pain often because the ovaries can get quite big, and lots of, blood supply as well and things like that.
It's truly amazing how different people can feel in response to those drugs. I see it all the time. Some people don't feel a single thing and the next person feels every single thing really big.
Absolutely. And that's, again, same thing as I think with all the menstrual cycles. Some girls don't
breeze through it,
like the same as menopause, isn't it?
Yeah, exactly. Yeah.
And I think it's just important to realise that our bodies are very different. And also I think other things you're having at the same time, stress, sleep, other medical conditions impact on how you might respond to that cycle. And I certainly know at times in my life, my period was much more problematic than it was at other times. So.
And what about your health in general in the lead up to it?
Yeah, I would say if you're thinking about freezing your eggs, then you should be thinking about that should just be a bit of a thought, of what am I doing about all my health?
Yeah, so improving your health in general.
100%. Some of the common things we think about, and I think is really important with women, is, alcohol. So that would probably be one of the things that I think you should be thinking about going into freezing your eggs. We now say as soon as you start trying, you should stop drinking. But also just in general, limiting the amount of alcohol you have. We know that alcohol is probably the biggest risk factor for breast cancer long-term in a woman's life. The guidelines are 1 to 2 drinks per day with at least 2 days of no alcohol. So that's a really important one that we talk about with all our patients. Things like smoking, I think it would be not great advice and probably a bit foolish to freeze your eggs while you're still smoking.
And can we put vaping into the same category?
Absolutely, yep. So I think all those things, whether it's marijuana, other drugs, you should consider really trying to stop doing that prior to going through a cycle of egg freezing. And then Also really important to talk to your women's health practitioner about what medications you're on as well.
Yep.
And then the other big one is being at a healthy weight.
Yep.
And that can be either underweight or overweight, but just having your body in the best condition possible.
Yeah, it makes a big difference to collections and the outcomes, doesn't it?
Yeah, absolutely. So if someone's, I guess, underweight, often the body can be in a more stressed state. And so it's your ovaries can be a lot more sleepier, so it's harder to wake them up. And also it's really important that your weight and your hormones for things like protecting your bones and other things as well. But we know that when people are overweight, they've got a higher level of systemic inflammation. And I guess things like smoking, alcohol, other things can cause higher states of inflammation, and that's not good for eggs.
Yeah, okay. And is this over a 3-month process? Do you have a minimum that you think about in terms of improving your health?
I mean, I would say, particularly if it's funny you talk about 3 months. I think men are lucky in that they are constantly making their sperm.
I know, they get off so easily in some ways.
Absolutely. And often we see that men can completely change their sperm profile.
I know, so quickly. It doesn't take a huge amount of work, does it?
Yeah, and that can be from just quitting smoking, marijuana, stopping drinking, losing some weight. So they're making their sperm every 76 days. Whereas women are born, I guess, with their eggs, but your eggs do their last division just before either you ovulate or have fertilization of a sperm and an egg, or before you had an egg pickup. So that last division of the egg is still very much reliant on having been healthy, age, BMI, things like that. So I would say, yeah, you should try and do it at least the 3 months beforehand. But I think with weight, and that is probably an important thing, is that the best way to lose weight is, I guess, a sustained long-term, something that's long-term going to be healthy.
So don't crash diet before you start.
Yeah, exactly. And I think the other thing with weight, which is important, is it's also, you are going to go through a medical procedure. And so if you're smoking or unhealthy or have high blood pressure or you're overweight, then your risk factors for the procedure of having a sedation and is much higher. So that's the other reason, is to make you recover from the procedure more.
And I think if you're doing this for insurance for your future fertility, it's worth the investment.
Yeah, 100%. Like, I just think about it this way. If you were going to go buy a house, many banks wouldn't give you a loan if you didn't have income protection now. Certainly was my experience when I bought my first house. I had to show I had income protection, and you probably wouldn't hike through Nepal without having some travel insurance. So I think it's now essentially a very available, cost-effective insurance policy. And so I think women should definitely explore it.
And is there an ideal age that we look at?
It's another great question. I think, as a reminder to everyone, and you would know this, Jaya, that a women's fertility declines quite a lot after the age of 35. And I guess the way that we counsel, and we've talked about this as a group, I would say that if you're 30 and you haven't got pregnancy or a partner on the radar in the next 1 to 2 years, but you want to have children, then you should probably think about freezing your eggs.
And some people would say you're crazy for saying that because it feels so young. But I say it to all my friends all the time, and they thought I was crazy, that they should consider freezing their eggs then. Because if you're over 35 or even further along, it gets so much harder.
Absolutely. And what we find is that we've spent so much time, and I'm hoping this will change for my own children, and certainly will for my daughter, because obviously her mother's a gynecologist. Yeah. I know growing up there was a lot of discussion around how not to get pregnant.
Oh, yeah, huge.
But not necessarily around your fertility, fertile windows, when to seek advice about when you're not getting pregnant or how to get pregnant. And you would say this, my mind's still blown that even myself, there's such a small window in a cycle.
So small.
Optimize getting pregnant. And some people are really lucky, but we just haven't, moved, as a society, to really empower women to be aware of their bodies when they want fertility, if they want fertility.
And we're having babies later.
Yeah, absolutely.
And I just see it all the time that I think a lot of people think IVF, I'll just do IVF later, not realising that it's not a sure thing. And I see really healthy women, and the only thing that's against them is the clock.
100%. And I think that's
sad.
Yeah, and it's unfortunate, but it is a fact of life. We've been able to, I think, delay so many things till we're ready, but we can't unfortunately change our biology. So I think starting the conversation, like podcasts like this one, are fantastic. Yeah. And then just putting that information out there that IVF's not a given ever, but if you're going to do it, or you're going to try and have a baby, then, you want to ideally try and be having those discussions.
Without the pressure of feeling like I've got to have a baby in my early 30s, maybe with someone that I'm not really sure about, having them more options.
Yeah, absolutely. And I also think that's the great thing now is people don't feel, because we've got, I guess, the tech. I think the thing that's important is that uteruses are quite good for a while.
Yeah.
Often there's not an issue holding and carrying the baby. There's some increased risks for women that are in their 40s having babies, but certainly if they're healthy in other ways, then they do really well in pregnancy. But your eggs, if we haven't got the eggs, and then we can't get pregnant.
And a donor egg can be a really difficult journey in itself.
Yeah, unfortunately, in Australia, it's unfortunately, not as accessible as we'd like it to be, and also quite timely. So again, by the time people have started their own IVF process and maybe haven't been able to go down that journey and then thinking about going to donor eggs, it's a couple more years. So I just think egg freezing has just now made it much more accessible that women can, again, people that are trans can then have that option to go back later on and maybe be able to use their own eggs.
And feel a bit more empowered about their own fertility.
Absolutely, yep.
Yeah, it's good.
I think one question that probably comes to mind for a lot of people that are listening to the podcast is the cost around egg freezing.
Yeah, absolutely. I guess the good thing is that there's, for many patients, particularly if they've got a medical reason, there is access to Medicare subsidies and rebates for going through the process of freezing your eggs, knowing that may
maybe a cancer diagnosis. Or...
Other things as well, such as often medical issues, such as if you've got quite significant severe endometriosis, that you may have a decline in your egg fertility, or say like a medical condition that might impact on your fertility long term, and you're trying to get that under control or being on medications, some of our inflammatory bowel conditions and things like that. So it's important to, wherever possible, when the avenue is to get a Medicare rebate, that's always sought.
Yep.
It's obviously not possible. Unfortunately, it's not, I guess, always possible for women that, I guess, are using it as an option if it's not the right time and things like that. But I'm hoping that moving forward, and again, as the word gets out, and I guess as a group of women, we're always advocating for our healthcare and what's best. And so moving forward, hopefully that does become that it's equitable to every woman. But you don't have to necessarily have private health insurance to undergo an egg freeze as well. There are different ways of doing it without having a private health cover. But again, it's whenever you go and talk about it, you can get a lot of information without having to commit to things. It's just empowering you to know about your choices as well.
Yeah.
And there wouldn't be any harm in having a consult with your specialist and just talking through all the options.
Yeah, because I remember in that consult, and we always also, let's talk about your cervical screening test, how you with the contraception, talking about, we always see a woman just not as, you're freezing your eggs, but what can we do here right now to make sure that we optimise your health and empower you and just make sure that you're getting, it's a good consult as well to look at all the other
and actually having a good workup. And when I say that, just checking your AMH and things like that to actually know what you're dealing with at this time.
Yeah, should we talk about AMH?
Yeah, let's go for it. I don't think you can not talk about it because it's important.
I think for anyone that's considering fertility, certainly if you're a couple going through fertility or having difficulties with subfertility, then it's certainly very valuable. And certainly for patients, I think if you're going to go through an egg freeze, an AMH is part of the workup to look at what your ovarian reserve is and how you may respond to medications. But it's also, I think, it can also sometimes throw up some unexpected results.
And to be clear, it is not a test that tells you how many eggs you have left.
No,
I think it comes out in the wrong way a lot of the time.
Yeah, absolutely. So I guess an AMH stands for anti-Müllerian hormone. And the way I explain it to patients is it's a little bit like, I think AMH and ovarian reserve is like Easter eggs at Easter. So you can get given a lot of Easter eggs and have lots given to you and have your baskets full, but maybe they're not great quality. Or you can get given a small bundle of really beautiful chocolate. And so I guess the quality is your age and the quantity varies amongst different women. So if I had a group of 25-year-olds in the same room, I'd be excited because they're 25 and their egg quality is great, but between them they would have different quantity or numbers of eggs that they're all carrying, and that's just genetics and biology and often runs down in family history. And then, if some of those girls had endometriosis and their AMH might be slightly lower on different medications. And AMH can also fluctuate a little bit as well, depending on whether you've been on the pill or having other medical conditions. But it is I think, again, it's often you do have to pay for the test. It's not completely subsidised by Medicare, but maybe that will change long term.
Oh, it's not? Okay.
No, it costs about $30 to $40 to get it done.
Oh, that's not too bad.
No.
Yeah.
But I think it's a very done appropriately with counselling, you shouldn't just do it by itself.
Yep.
But it can help give you more information.
And I think that's important to remember because it's not just about age. There can be lots of other factors. So having a consult or looking into your own individual health is just really important.
Absolutely, yep.
Before making the decision.
Yep.
What about ongoing rent for freezing your eggs?
Yeah, so great question. And then we'll talk about what happens with the eggs too long term if you don't use them.
Yes.
It's a couple of $100 a year.
Oh, that's reasonable.
Yeah.
I thought it'd be much more.
No, I think it depends on the lab, but I actually had a look at our lab through Surf Coast Fertility.
Yeah.
And it's, $200 a year.
And is there a time limit that they can keep them there?
I don't think we've probably got the data at the moment, but obviously what you would do is most people would wait till they've finished their family or...
Yeah, okay. It might be different because I'm thinking about with IVF, they have, is it 10 years or something?
You normally rent the space for a certain amount of time. Yeah. And then it comes up for rent and space. But it's interesting with us having a chat to Russell Dalton about embryos and eggs because people often go, I want to freeze them, I want these eggs, but I don't really want them. You can either give them away or they might want to use them, but I also, what do I do with these embryos? They're really important to me.
Yeah.
And there's actually this really great new thing where you can do, it's called compassionate thaw. And actually what you would do is pop the embryos or the frozen eggs in the posterior fornix and then allow them to naturally, I guess, pass on.
Can you explain that?
So if I had completed my family, say I was going to get pregnant and I was going to have an embryo, normally the embryo would be inserted up through the cervix, up into the uterus at the right time of the cycle, timed. Whereas if I'd finished now having my family but had some embryos left over and didn't want to just thaw them, then what you could do is actually just put the embryo in the posterior fornix in the vagina.
Yeah. Ah, wow.
It's like a compassionate disposal,
Oh, right.
I have not heard of that before.
Yeah,
Is that happening now?
It's starting to happen, yeah.
Wow.
Because a lot of people worry about what's going to happen with their embryos after everyone has different values and beliefs about them, but there's a proportion of people that see them as
children
or a few cells or
a bit of DNA,
DNA, something that's living already. So for those people that want that as an option, that's becoming available,
So what are the options?
With the eggs?
So you've got all your frozen eggs, but you didn't end up needing them, or maybe you had a few of them and then there's leftover ones.
So say, I guess the thing with eggs, with this whole, I guess, egg freezing thing is we've certainly seen some women that froze their eggs because they weren't sure if they're going to meet Mr. Right.
Yep.
And then 24 months later, they come back and see me. They're 33 and they've met like this great partner and they want to have a baby. And they say, we're just going to give it a go. If we can't get pregnant, we'll use the eggs. Others have said, I've used those eggs, I would like to thaw them down now and make embryos. You've got them as the insurance policy, you don't necessarily have to use it. But then I guess what do you do when you finish with your eggs? I guess you're like, we're done with our eggs now, what do we do? We've either used them or we haven't had to use them. You can either donate them, you can dispose of them. And I guess there's now this option of, I guess, compassionate disposing of the embryos, but I guess making sure that you dispose of them in a way that you...
Do you see people donate very often?
I guess not as much as we would hope for. It's such a unique kind of situation, isn't it? But people certainly do donate. Yeah, there is a way of donating, having donor embryos. Yep.
Yeah.
See it from time to time. I guess there's the unknown donor versus a known donor.
Yeah.
But yeah, we do see it from time to time.
Lots of cancelling.
Hey?
Lots of cancelling.
Absolutely. Yeah. Special person that does that. I just think they're pretty incredible.
Yeah, I agree. What's next, Libby?
I guess what are the sort of success rates when it comes?
Yes.
Is it similar to IVF or because you've got those younger eggs?
And I guess wondering how it compares to an embryo when you defrost it.
Yeah, I see what you're saying. I guess the first thing to think about is nothing's a given.
Mm-hmm.
Yeah.
I guess if you get the egg qualities and you pick them up and you're at a healthy age with no other medical issues, then say you had those eggs and then thawed them down, then you'd have a 97% survival rate and then you have the same fertilisation rate as a fresh egg. So once you get the thaw down and use the egg, they would be seen as the same success rate of making an embryo and same kind of long-term kind of outcomes, which is, does that make sense?
Yeah.
Yep.
Yeah.
But the problem is that sometimes when we can have issues with fertilisation and things like that, we might be able to pick up a woman's eggs, no problem. But then when we go to make the embryo, there's issues. And so that's the kind of thing we can't predict.
Also,
but that can happen with
sperm quality.
Yeah, exactly right.
Things like that.
Yeah.
Okay.
There's so
Are there
many
any
steps?
Yeah. Do you know if there's any stats?
Put
you on the spot here about the success of freezing eggs and then them going on to make babies?
So I'd say you'd need to have so I guess what we'd say is so many factors like that. I guess in a woman's cycle of IVF or an egg pickup, there's so many confounding factors looking at, I guess, fertilization and baby rates. But what I guess the stat to take out of it is that if you freeze your eggs and the thaw down rate's so good that the fertilization and baby rate is the same as using a fresh egg versus a thawed egg. Does that make sense?
Yep.
Yeah.
And I guess depending on the lab, I guess it's probably about a 17% pregnancy rate per embryo transfer. Does that make sense?
Yeah. Okay.
So they're the same.
And in the long term, you're trying to give yourself a better chance of you having a baby with your own eggs.
Absolutely, yeah.
Yeah. And are there other reasons that why a woman would want to freeze her eggs besides being single? Are there medical reasons?
Yeah, I think if we know you've got very significant, like maybe you've got a tricky medical condition, so it could be, and you're trying to get that under control, but we know you might need to delay that for a few years or things like that. So things that could impact on fertility, like endometriosis.
Yeah, okay.
I've seen it sometimes with inflammatory bowel disease. So maybe they want to freeze their eggs now, but they're not ready to get pregnant and their overall disease isn't under control enough. They might want to have a few years of, and maybe need to get like a bowel resection done or go on some medications to get that under control. So they're wanting to start medication for a few weeks for like a autoimmune condition for like arthritis or something like that. But I think most of all, I think that's always been
There, but
in the
now,
background.
now,
But now I guess what it
socials
is
of
more of a choice, helping women with their fertility. I think that's really what is now accessible to everyone.
Yeah. And it would be good if there were more conversations starting with their GP
Yes.
or somewhere. And this is where this episode came from, going, I wish more people knew about it
Yeah, absolutely.
and thought about it earlier, because they're not going to make the decision straight away. They're going to think about it over time.
And often people might talk about something, it might be like, I should do this about my health. And there's often a contemplation, with everything you would know, there's often like a phase of reflection and contemplation and do I really want to do this? And then you gather more information. And so that's why just knowing that it's out there, like most people don't go, I'm going to freeze my eggs, I'm going to do it next month. They think about it for a while. They want to go.
Especially with the cost of it.
Yeah,
It's an investment.
absolutely. So I think there's a lot of that stuff that needs to go on. And then you also need to have some counselling and
Cancelling a requirement to do it?
for egg freezing. No, actually having
IVF's
yeah.
different. Yeah. Still would be beneficial.
Absolutely. I think it's important I think you definitely need to have some consults with one of us and also with one of the nurses to step you through the process to understand the risks and the benefits and I guess what it means. And I think also the goals of care.
Yeah.
I think another thing that's really important to also talk to women about that with things like egg freezing and certainly with IVF is now sometimes what we'll do is do something. Have you heard of duostim? Where we'll often...
Yes. I feel like you're the only clinic that are doing it.
Yes.
That I know of.
Can you tell me what it is? I don't know.
Yeah, so I guess to not sound too scientific.
A little bit of science is fine.
No, but it's actually pretty amazing. So our bodies are constantly recruiting waves of follicle, but maybe once a month we might ovulate.
Yep.
But what your body's constantly in the background recruiting. So we know that there's constant kind of waves of, it's called the waves of recruitment theory. So we know that there's eggs always ready to be recruited. And so what it means is that we might put you through an IVF cycle, pick up lots of eggs and say, oh, we got 12 or we didn't. Sometimes you also might not pick up as many as we want because women respond differently to the medications and, you know, you don't want to hyperstimulate someone because they can get quite unwell and there's some risk. So sometimes everyone responds differently to things.
Yeah.
And so what you can do is do an egg pickup and then immediately go back in to recruit the next wave of follicles.
Oh, okay.
So you don't have to kind of wait.
Like catching the next wave.
Catching them. Yeah, it's like surfing. We're on the surf coast. It's like you're off. That was pretty good. You're going to paddle straight back around and get the next
So then you
wave.
start medication again.
You'd start the medications again to recruit. Yep.
I remember doing an assignment on basically this theory for
Through the masters.
Yeah, it was my first assignment and I was like, oh wow. But the results were that the eggs collected from, I guess, that second wave in that what would be a luteal phase were just as
This
good,
is good. I know.
as those first ones.
Wow.
So let's say you've got a really low AMH, you're not responding that well to the drugs, like you're not getting lots of eggs. I guess it's a good way to get more in.
Yeah, or you might think it's an emotional thing going through a cycle and people have often put things on hold and like you said, we've talked about often stopping medications or really in change, and they just want to get into the next one. So rather than waiting, what traditionally we would have thought have to wait for another whole period to be in the right phase of the hormones, if we just stimulate you again straight away, it's called duo stim, so duo being double. And guess what Jay is saying is that the results are as good as waiting to go to day 2 of your period before you start the medications on day 3.
Yeah.
And I guess because if you were doing a duo stim, you wouldn't have really a high AMH. You wouldn't be responding in the same way of getting huge amounts of bloating and pain.
Yeah. I guess it also just allows you to adjust for the next cycle if you didn't quite think you stimulated as well and things like that.
And also a good option if you're time poor, in the sense, let's say you've got cancer and you need to start treatment.
Yeah, or you're just a time poor busy woman as well. That's I just want to get it done as well.
So is that something you would offer for someone who wanted to freeze their eggs?
Absolutely, yeah. We offer it to every patient, and we certainly offer it if the first cycle, the first round, we thought we maybe shouldn't say the word push, but maybe stimulate the ovaries a little bit more. We would say, look, we offer it always a duo stim. Yep.
That's good to know.
And it's also slightly more cost effective as well, rather than waiting for another cycle.
Because you're already in it.
Yeah. So you pay a little bit more rather than paying for a whole new cycle.
Exactly, yeah.
Yeah.
Well, fascinating.
And also then I think it's important to know that then, because there's the thing in fertility is there's the picking up of the egg and there's the clinical pregnancy rate, but there's the take-home baby rate. So that's what everyone, long-term, that's the goal, to have a baby. And again, those outcomes are as good as having just a standard IVF cycle or kind of pick up. Does that make sense?
Yeah.
Yeah.
Wow, this has been so fascinating.
Yeah, there's so much to it, isn't there?
Just our bodies. Yeah, they're amazing.
Yeah.
And it's just a lot to think about, and you've actually got a lot of options.
Absolutely, yeah. I think it's just important, again, to spread that word, but also and make sure that women can access the information. Yes. There's not barriers to go and have the conversations, but also make sure if you're going to think about embarking on something like that, you're engaging with your whole health team, whether it's your naturopath and your physio or your dietitian.
Getting yourself ready. Yeah. And then finding a team that really works for you, where you feel like you can ask all the right questions and get really informed.
Yep. For the best success as well.
Yeah, I agree. Decrease your stress.
Yes.
Cool. Have we covered everything?
We've covered everything.
Thank you so much.
Questions.
Great.
That's fantastic. Thank you for listening. If you enjoyed today's episode, please share it with a friend, subscribe where you listen, or head to Apple to rate and review. You will find the show notes on our website, conceivethepodcast.com.au, and can follow us on Instagram at conceive_podcast, where you can also leave questions for future episodes.